Our friends at Desert Oasis Healthcare are introducing a new way to help patients and their healthcare team work together to make sure medications are being taken correctly. Pharmacist Lindsay Valenzuela, the Administrator of Population Health and Prescription Management at DOHC, and Dr. Scooter Plowman with Proteus Digital Health are here to share the exciting news. How you doing?
Great, doing really well.
Wonderful.
Thanks,
Welcome to the show.
Thank you for having us.
Of course, of course. So I'm just going to fire some questions at you guys and you can figure out who's going to answer, all right?
That works.
All right, so what are digital medicines and what is Proteus Discover?
Yeah, great. So digital medicines are medicines that actually provide feedback to you. So currently, and most of us are accustomed to our medications as just entities that we pick up at the pharmacy, for instance. And what we believe, and we actually know from literature, is that only about 50% of people take their medicines as they were prescribed. And so what we've decided is, rather than maybe saying the patients are the ones to blame or the patients are the ones that are struggling when half the population is having trouble, why not change the product? And so we've developed a medication or a field of medicines that have a little sensor inside of them. It's made of dietary minerals, so it's made of food products. It's actually the size of a grain of sand, and it goes inside of your medications, and when you swallow it, it turns on. It turns on for about 90 seconds. It puts out a really tiny signal, about similar to like what your heartbeat might put out, an electrical signal. And it's enough that we can now pick it up, and you have a small Band-Aid that you wear. The Band-Aid measures not only your heart rate, your respiratory, your heart rate, your rest, your activity, and your step count.
I mean, you can see my expression.
Yeah. It sounds like
just kidding.
No, it sounds like science fiction, but honestly, like this is the real deal, and we now know exactly. We know exactly when you take your medicines.
So cool, and I love sci-fi. So this is just, I mean, not that this is sci-fi, this is reality, but the future is here. This is amazing. Okay, so why are they important to patients and how do they help? Give us a little more detail.
Yeah, go ahead, Lindsay.
Well, I think right now the conversation that we have with patients when we're managing chronic diseases, such as high blood pressure, high cholesterol, or diabetes, is there's a disconnect. We assume they're taking the medications that we prescribe and ask them to take, and they assume that we understand why it might be difficult for them to do that. And so using these medications allows us to have a different conversation. As they're taking their medications or not taking them, we can then match that against things like blood pressure and weight. And when we have a conversation about that in the office, they can see, oh wow, when I don't take my medications, I really don't do as well. So it changes the conversation into something where both parties are contributing.
This is huge. And also, people can kind of get into trouble, right? Like, you need to stay on your meds. We know you're cheating, or we know you're missing medication, things like that, right?
You know, it's interesting you say that, because it's really never been about that. In fact, so the word adherence is often used in medication taking, or, you know, is the patient adhering to their medicines? And again, I think the conversation is actually more about empowerment and engagement, right? Patients often don't have the same information we as healthcare providers have. They don't often understand how their condition fully works. What is high blood pressure? Why do I have it? What is this white pill doing for me? And when all this information is put onto your cell phone, when you can now see every day, hey, I took the white pill and I know what that white pill means and I know exactly what it's doing for me. And then you can see how it impacts your step count, how you have more energy in the afternoon, or all of these things tie back, and it's really this system of feedback. And I say feedback because all this is behavior change. And for us to make behavior change, we need the feedback. We need it in the gym, we need it in the classroom, at work. And in healthcare, we're not very good often about giving regular, specific, timely feedback. And that's what these medicines do, is deliver a system of feedback that really empowers patients. And I don't think they ever feel like they're in trouble. They actually feel like they're an equal member of the care team.
I'm actually kind of glad I asked that. I ate up a lot of time with that question, but I had to ask. So when will this be available?
It's already available. We started enrolling our members about 2 weeks ago, and the feedback has been amazing. Our patients are really excited to have this type of technology in their hands, and the conversation has just turned from one of fear when they come in to one of really excitement.
Yeah, and fascination.
Definitely.
Dad, if you're watching, we're getting you signed up to get a prescription for Proteus Discover to help get your hypertension or diabetes under control. Contact your healthcare provider or at Desert Oasis Healthcare at 760-969-6560. Desert Oasis Healthcare is located in Palm Springs. Give them a call and visit their website at mydohc.com. A big thanks to Lindsay and Dr. Plowman for being on the show. Very cool. We'll see you after the break.
Thanks, Brian.
Yeah.